سهل guys, don't worry. Okay, start. Yalla, assalamu alaikum everyone. I hope you're all doing well. I hope you're preparing well for your mid-unit. بدكم microphone ولا? You can hear me. شوف. تمام, okay. So, inshallah today we're going to be revising for microbiology stuff. We're going to do it in order of first, we're going to start with the normal microbiota flora, DPT, then we're going to go to staph and streptococci, and finally we're going to explain the viral, what were they called? Genetics, mechanisms of disease, etc. So let's start with an easy lecture, which is normal microbial flora. So the way this session is going to go is that we'll first put up a question. Whoever wants to guess or whoever wants to answer, you could raise your hand, we'll choose you, we'll answer, and then we'll discuss. Now it's difficult, we'll explain it to you guys further. Now it's fine, we'll move on to the next concept. The questions that we put for you guys are the high yield stuff that you need to know for this exam. Akid, we're not able to go through every single slide, so make sure and know, Kaman, you actually go through the lectures. So first question, easy one. Who wants to answer? C, exactly. Why?
Virus.
Exactly, because it's a virus. So the first thing you need to know in this lecture that all the organisms that are considered as a part of the microbial flora are either bacteria or fungi. Viruses and parasites are not considered as part of the normal flora because as soon as they come on our bodies, they will cause disease immediately. We cannot live with them normally. Tamam? So next one. So I just put this quickly. This was from the lecture, and he told you guys that in total, we have 4 species of bacteria that constitute the flora. They make up 92%, so the remaining are going to be fungi. So we have actinobacteria, 36%, they're the majority ones. We have firmicides, proteobacteria, bacteroidetes. Now, are you going to get a question about this? I'm not sure, but know this, just to be on the safe side. Yes, go ahead.
You told me that there are no parasites and viruses in the normal microbiota.
Exactly, yeah.
It's written that, I'm not sure he wrote this, but he wrote that normal microbiota are ecological community of common cells, symbiotic and pathogenic microorganisms.
Exactly. Now, the idea here is that me and you guys, we all have bacteria in our bodies right now. But why don't they cause disease? Why? Why do you think? Because of the immune system, or because there's a balance, because especially the ones in the GIT, they're helping us break down the food. So I'll get to that in a minute, but these are pathogenic if in certain circumstances, and I will show you where the circumstances of these flora get disturbed. So good question, thank you for asking that. Okay, next question. Can you please raise your hand because we have like candy, or we want to, give it to whoever answers. Guys, raise your hand to read, it's okay. You can try. Yes, go ahead, Shad. C, exactly. Why? Exactly. So here the concept that I want you guys to understand is that you have an infant, and in the beginning of life, they usually are, first of all, the flora in the mouth is colonized by a certain type, but then after, which is not really important for you guys to know, which is, I think, salivarius. And then after these teeth start coming out and erupting, you will have the colonization of strep sanguis and strep mutans. And I'll come back to this when we go and talk about streptococcus. So make sure that you guys know this, because in this lesson, the examples are very, very, very important. He will ask you about the examples. Okay, next one. This one's easy. Yes, go ahead, say. No, yes, correct. So here, it said that there's an outbreak of sepsis that's caused by Staphylococcus aureus. And Staphylococcus aureus is found on skin, it's found in several places, but here skin is not included. So the most correct answer is the nose. Type the colon. What are the microbiota that we find in the colon? E. coli, good one. Okay. What about the throat and the mouth? Pneumonia. Okay, another one. Mutans, verdans species. Okay, what about the vagina? This one's also a very important example. Lactobacillus, exactly. And I'll ask you a question about it now. Okay, yeah, here it is. Go ahead, Saif. Exactly. Okay, the others are wrong. شوفوا how, for example, he could put something that's similar to this to confuse you guys. So the answer here, حتى saprophyticus, you guys learned this in microbiology, so you might think this is the answer. So make sure you read the options thoroughly and you read the question. So here, basically, here there's nothing wrong because it's a normal swab. So what's normally found colonizing the vagina is Lactobacillus acidophilus. Now, a bonus question. Why does the species specifically colonize? Yes, go ahead. Yes. Exactly, yes. Yes, bravo. So basically, the female genital tract produces a lot of glycogen. So the reason why this bacteria loves colonizing this area is because it uses glycogen to produce lactates. And yes, that's pretty much it. Next question, guys. So far, is everything okay? Does anyone want to ask anything so far? كله تمام, guys? Okay. Heather from this side. This side's inactive. No, you guys answered. Let the girls answer, haram. What do you guys think? So we have a man presenting to the ER with severe abdominal pain and signs of sepsis, and he underwent a colonoscopy. And here what happened is that there's presence of anaerobic bacteria specifically. Now, which of the following is the most likely one isolated from this? D. No, it's D, bacterioids. It's an anaerobic. You have to pay attention to those keywords. Got it, guys? Tamam. Now, important things to remember before I move on to the next point is that the gastrointestinal tract has the largest number of flora in our body. Why is that? Can anyone guess? Okay, other than that? Yes, go ahead.
Its pH is high and the environment is good for the.
Okay, so another reason, why does it help us? Digestion of food, excellent. So this is important for our GIT. And it increases as you go down, and it's the largest number in your large intestine. Most common aerobe, remember, it's E. coli. The most common anaerobe is a Bacteroides fragilis. So remember these keywords, guys. And as I said, the examples are very, very important in this lecture. Okay, so you guys have this figure. I'm not sure if you were told to memorize it or not, but I want you guys to familiarize yourself with it, to get used to it, because you never know, okay? So be safe. And as I said, the GI tract has the highest amount, and you'll find the least amount of blood, because when it comes to blood, which travels to other organs, specifically disturbance, this is when infection will start. Okay. Next question. So basically here you have a patient that was treated with antibiotics. And then after that, she started developing diarrhea, abdominal pain, and fever, and they did tests. They confirmed that she has a C. diff infection. So what's the cause here? Yes, please. Pseudomembranous colitis, exactly. So the idea here for this question is that a lot of the times when you give patients antibiotics, these antibiotics will kill the flora that the patient already has. فبصير في a disbalance. The flora that's usually there taking over, making sure ما في infection. Once you get rid of this through antibiotics, it will cause other symptoms. That's why whenever you guys see side effects of X drug or X disease, a lot of them are abdominal pain, diarrhea, etc. And this is one of the reasons that there's a disturbance in the gut microbiota. Tamam. So just quickly emphasizing on this point, there are two changes that could disturb the microbiota flora. As I told you guys, antibiotic therapy will kill the flora in our body, and an example is C. difficile. It will be able to proliferate and enjoy its life, and the more it proliferates, the more it can cause diarrheal disease and colitis. The other case is hospitalization. When a patient is hospitalized for any reason, basically the normal organisms that are being found in your body will get replaced by other organisms that are actually more pathogenic. A good example here is the Klebsiella species and the Pseudomonas species, which will cause pneumonia, for example. Okay, so keep this idea in mind. Matching questions. So I'll start, for example, opportunistic. Who wants to answer? With the new hands, somebody. Yes, please, go ahead. Yes, please, go ahead. Yes, so which letter would it be? E, exactly. You guys will learn about this later on in microbiology more, but keep in mind that opportunistic infections, يعني, in a normal healthy person, they will not cause for you disease. But in an immunocompromised patient, like one that's undergoing chemotherapy, one that has any sort of chronic illness, they will cause a bad infection. And for example, the common cold. When we get a common cold, عادي, 2-3 days, maximum a week, we'll be fine. بس in an immunocompromised patient يمكن يطول معه يمكن يروحوا they'll go to the hospital and it will be more serious for them. Yes, you want to ask a question ولا? Yes, please go ahead.
المايكوبكتيريوم تيوبركلوسيس ليش نعتبره برايمري باثوجين او باثوجين؟ ليش مو اوبورتونستيك؟ انا حسب ما بعرف هو بيدخل على الماكروفيج والماكروفيج ما بتقدر تبلعه او ما بتقدر بس بضل فيه وما بصير شيء، يعني ما بتظهر اعراض للزلمه. بعدين لو صار له اميونو كومبرومايز بس بتبين اعراض، فليش ما نعتبرها اوبورتونستيك؟ نفس التعريف.
طب هلا لو انت لا سمح الله you got a TB infection حتتعب؟ Will you get like actually sick؟
حسب ما تعلمت انا انه لا. انا ما اخذت غير اميون سيستم من بايو 2 هاي بتذكر.
No matter what. That's why you get vaccinations. It's very important for you guys to take TB vaccinations. You got the idea. Sama? All right. So nosocomial infections. This is another important definition you need to know. Yes, please. Sorry, you said D? D, yes, correct. They originate in a hospital. And why are they important? Because you will learn classifications later on and know this is nosocomial, this is community acquired. So make sure you guys know this well. طيب, strict pathogens. Yes, please. لا لا لا, Gaia. Yes, correct. That's what Mohammed mentioned, that they're... Yes, go ahead. Yeah. What's the difference between what?
Primary pathogen and strict pathogen.
As far as I know, a strict pathogen إنه خلاص as soon as you يعني for example as soon as you get it infection no matter who you are, okay? Primary pathogen, I think it's what's it called? It has an ability to cause the disease, صح? Well, I think they're interchangeable. If I'm not mistaken, he's not going to put them both in a multiple choice question and make you choose between them. But enter just know the definition of a strict pathogen. This is more important for the exam. طيب, colonization. Yes, please. Exactly. Attachment and multiplication. Last one, invasiveness. Yes, safe. Ability to spread beyond its introduction site. So let's say the organism gets introduced into a site in your skin. It doesn't stay there. It spreads. It goes, for example, to your lungs. It affects your lungs. It goes to the CNS, causes meningitis, etc. So this is the idea here. These are the answers. So I mentioned nosocomial infections, and I want you guys to emphasize this. This was the last slide in your lecture, and I have a feeling you guys didn't focus on it. But make sure that you know the most common cause of nosocomial infections is associated with UTIs. What are UTIs caused by normally? Catheters, but no, I mean like what in the hospital would cause them? Catheters, exactly. What about pneumonia? Ventilators, exactly. And surgical site infections and bloodstream infections? Surgeries, من الآخر. تمام? So keep those ideas in mind. They're easy, but يعني he could ask you about them. And that's it for the floor lecture. Moving on to the DPT lecture, which will be given by Malak. Thank you. Okay. Yes, yes.
نعمل ثلاثة عن شخص فقط.
على البرصة يعني؟ Yeah, I know. Okay, يلا. First question, guys. Copyright يعني شو? Who wants to answer? Yeah. DBT. ايه؟ مين كمان؟ قرروا diphtheria ولا pertussis؟ انت بتحكي pertussis؟ F؟ طب who thinks E؟ Who thinks pertussis? Raise your hand. طب who thinks diphtheria? Diphtheria. طب who can tell me why it's diphtheria or it's not pertussis? بالضبط, yes. Okay, so look for keywords. مهما كان the question is long وهالسوالف, always look for the keywords. Yes. DPT دكتور نهاد. Okay, any questions here? خلاص, we move on? Okay, يلا, next question. What? he said it beside you. It's the agar. It's these words basically. هاد كله. He didn't? خلاص, سامحوني guys. we had to memorize them. I'm so sorry. خلاص, ignore this part. Ignore this part. Okay, يلا, this question. What? B? يلا. A? Again, one more time. C? Who? بالضبط. E. Explain, Julie, why is it E? جماعة مش دارسين المحاضرة؟ طب when we're treating diphtheria, we're treating the free toxins that are traveling in the body. صح ولا لا؟ diphtheria toxin. Diphtheria toxin. did you guys know يعني عرفتوا which disease we're talking about here أصلا؟ diphtheria, صح? Why? Pseudomembrane cervical lymphadenopathy. صح, على طول we think diphtheria, right? How to treat diphtheria? We have to target the free-flowing diphtheria toxins. صح? No. In this one, the main key point about diphtheria is we target the toxins released by the bacteria itself. Okay, it's in the slides. I used your slides for this. So we target the circulating proteins. We do not target the actual cells. Sometimes yes, sometimes no. But that's why I'm saying, and we need to learn how to skim the question, find the important words. خليها في بالك وطنش الثاني. Yes.
الجزئية الأولى تجي على هذا الشكل نفس الامتحان.
نص.
أنا بدي أعرف من وين ننزل هذا.
لا جماعة, I'm telling you, شفتوا pseudomembrane formation, cervical lymphadenopathy, diphtheria. How do I treat diphtheria? The circulating toxins immunoglobulins that target the circulating proteins. انتوا قاعدين بتصعبوها. Look for the keywords, solve it based on the keywords. حتى لما توصلوا like year 2 you'll only look for the keywords وتتوكلوا على الله. You're gonna ignore the tests وهيك unless they signify that oh this test low levels مثلا. That's it. Other words بطنشها عادي. زي هون they're talking about the ECG. You don't need it because you already know the diagnosis. خلاص, you know. Okay. Any other questions? ما طمنتولي بس يلا. يلا next question guys. Yes. أيوه. طب explain why. B, yes, explain. بالضبط, exactly. The main characteristic of diphtheria is that an elongation factor 2. He could ask you which elongation factor مثلا. Okay? But what happens during diphtheria is, I think there's a picture that shows it in Dr. Nihar's slides, and it affects this elongation factor. Okay? So in other words, it affects the translocation of the ribosome along the mRNA. Make sense? No. When do we do the elongation factor? Cell cycle يا جماعة. لا, cell cycle. When does it happen? خلاص, it's okay. بس يعني translocation is the same thing as إنه it's affecting the elongation factor too. Okay? Make sense? Next question. سترت. يلا. C. D. Okay. C و D. Who said C? Who said D? D, C. Okay. Who else? Does anyone think it could be something else? B? A? طب okay. Who says A? Raise your hand. Who says okay? Who says B? Who says B يا جماعة? No one? C. Who thinks it's C? Okay. D. Okay. خلاص. Reveal. Guys, be confident. Say it عادي يعني. It's not like I'm deducting marks. لا, they're all correct. صح? طب wait, somebody. Shahad, you said B, صح? D. Why do you think D is wrong? ما هو for lysogenic, after it finishes at some point, it goes into the lytic cycle. Yes, it's part of it. Yes, it's part of it. هو Dr. Nihar has it as a picture. Okay? Please try to understand what's going on in the picture. It says it, I think, at one point. It says, at some point under stress, it undergoes the lytic cycle at some point. But please do go over the two paths. Understand what's the difference between lysogenic and lytic. Okay? لا, حكيت إنه lysogenic at some point at the end, when it finishes everything, it may enter the lytic cycle. It may. مكتوبة صح? It's written. مفهومة يعني. هو at some point it's gonna خلاص it needs to go. صح ولا لا? It makes sense. Okay? Makes sense? Makes sense ولا لا? There's this picture, please understand it. It helps you understand things later on. Okay? I move on from this question. صح. The phage enters, infects the cell. This is the step of lysogenic, صح? happens in both. They come infect the cell. The difference is بيكون B, C. The phage DNA هاي lysogenic بتحب تدخل حالها في الأمور. أنفها كبير. It's a nosy person. تروح it incorporates its own DNA into the cell's DNA. Then the DNA starts dividing. With this recombinant DNA, now we have recombinant DNA. Now all of the divided cells are infected. But at some point the cell has to die, صح ولا لا؟ بس it's that simple. Okay, makes sense now? We're sure? We move on? Okay, this is what I was talking about. I'm gonna explain. Okay, sure. Attachment, penetration is the common thing between them. What's different about is how the DNA gets incorporated, basically. Hello? Here, it becomes, like I said, بيحب يدخل حاله في الأمور, lysogenic. It becomes part of the cell's DNA. if it's incorporated in the DNA, the cell will continue cell division, صح? It doesn't think there's something wrong. It's going to continue dividing. Now all the cells are infected. At some point, it will enter the lytic thing to release the proteins it's being produced, صح? Now what's the point of me producing bad proteins if I'm going to keep them to myself? لا, I want to infect others. Make sense? Lysogenic makes sense? Okay? You're sure? شكلك مش فاهم أصلا. Yes. Makes sense this one? فهمت على الأقل? Okay? Maintenance is it building the proteins. After it gets divided, it's building the proteins. صح? It's cooking up basically. بعدين induction, بعدين it releases. Okay. But one thing is the doctor may put a question that says prophage. If you see prophage, lysogenic. Because it's talking about prophage is what?
When the هذا incorporates.
بالضبط. وإحنا when did we say that happens? Lytic or lysogenic? Lysogenic. So as soon as you see prophage, lysogenic, نتوكل على الله خلاص. Okay? Does this make sense?
Yes.
Okay? I recommend watching a video to further understand. Okay? Okay. Who can answer this question? B. Okay. This is a trick the doctor could do. He's done it before. He will change one simple word. In this exam, you'd be stressed out. You may just read it quickly, and you won't even realize that transudate is wrong. Okay? Do we know why transudate is wrong? خلاص. Okay. Do you want me to explain what's the difference between transudate and exudate? Okay. Here we go. Transudate, exudate. Briefly, you don't need to know it in details. Transudate has a low protein content, exudate high protein content. Okay? فأكيد they're not going to be the same, right? Transudate, it's going to be a few cells, مش كثير. بس احنا we know what happens during diphtheria. مش في lymphadenopathy? If I have a few cells, I'm not going to get this bull's neck, basically, The high number of cells, including inflammatory cells. Does this point make sense why it's more, not few? Okay. Appearance, clear and watery. Here, appearance, cloudy and thick. Pseudomembrane. Remember, it's gray in color. And it matches in its exudate, it's not transudate. Make sense? Okay, this is just, you don't need to know it best, just for your general knowledge, basically. FYI, بالضبط. Yeah. Who wants to answer this question? See? صح. خلاص, we know this. Okay? Come on, make sure they say toxin. Okay? لازم تكون toxin for it to be the ELIC test. Okay? He did not specify it in your thing, so you don't need to know it, but it's one of the culture thingies, the other. Or it could possibly be PCR. Okay? But all you need to know is ELIC test. I don't think he can ask you about the others because he didn't mention anything about it. Okay, this one. لا. You already answered. I need new hands. لا سمعتك ما قنا. يلا بنات. اللي قدام. سيف. خلاص يلا ها طب it's A طب why did you think it's C elongation احنا شو حكينا elongation oh sorry makes sense what disease are we talking about here pertussis whooping cough okay key word at the top what does it say it says vomited after several times of coughing على طول I know it whooping cough I'm not talking about diphtheria anymore خلاص I leave my diphtheria knowledge I go to my pertussis hello and what happens during pertussis or my whooping cough my cyclic AMP levels increase صح we know this isn't okay خلاص make sense لا في بس it's not in the whooping cough في بس it's not so that's why you should also clearly read the question صح خلاص يلا next one somebody else somebody else somebody else girls at the back so sorry what do you guys think the answer is طب شهد what do you think the answer is see does everyone agree ولا see everyone agrees صح هاي PCR هاي لازم تحفظها انه
وانا كنت حقول ايه؟ يحطون له اكسجين.
was it mentioned in your slides
ما اعرف.
PCR is there bronchodilator موجود as soon as you see something you don't know خلاص ignore it it's not going to be the answer أكيد the doctors will not get you something that's not in the slides
لا بالعكس
ولا they didn't say
لا ممكن مثلا يجيبوا اختيارات تعرف غلط تختار رابع
بس هو here احنا we saw PCR before did we see bronchodilators هنعطي diphtheria no أكيد صح corticosteroids why am I giving corticosteroids to a patient with whooping cough صح yes they never هو so in this question because this is a amboss question they never actually diagnose the patient بس كمان also the factor إنه it's not mentioned in your slides bronchodilator موجودة خلاص طنشوا خلاص act like it does not exist you don't need to worry about bronchodilators please leave them for next year they're gonna come to you next year don't worry okay ما تعقدوا الأمور سهلة خلاص keep it easy do not complicate it further okay are we okay with this question خلاص I move on يلا this question حدا تاني جولي B okay صح you're correct I have a mnemonic if you guys don't remember but you don't want mnemonic
بدي المونك
this is the mnemonic okay bear with me شوي catarrhal stage we have the fever the cold هيك صح this is for football fans but كمان if you understand it it will be easier why did I put cold there what's his signature move Cole Palmer the celebration مش هي انه he's cold فهم علي يعني it's just I'm trying to make it easier for you to memorize يعني okay cold بعدين عندك Palmer's the letters P L و M paroxysmal stage you have mucus production this one is important he could ask you about it because it was highlighted it was underlined okay يعني you forget this it's fine do not forget this one okay it's in the paroxysmal stage then in the last one complications convalescent stage pneumonia convulsions and ear infections okay please anytime there's like stages memorize the stages, what happens in each stage. Okay? I don't think there were numbers for these, like how many weeks, صح? No? Okay. Oh, okay, sorry. Okay, good. خلاص, we move on? Yeah, the next question. This one is pharma micro a bit, but it was mentioned in your micro slides. Find the keywords yourself. جربوا. طب you guys want to do it together? لسه ما خلصت.
Higher fragrance.
We do it together?
B.
B? Okay. B? B? لا.
C.
C.
جاوب مرة قلت C.
I didn't hear and I heard B. Does everyone understand why? It's mentioned في slides, لا? Azithromycin. It is mentioned in the slides. فهو you don't have to worry about the oral part because all of them are oral, you know? Ignore the oral part, we go to the actual medical part. احنا we know azithromycin is for what disease is this? Oh yeah. It's gonna be whooping. ما هو ايوه it says here worsening cough. خلاص؟ we know انه it's pertussis صح؟ ما هو I'm explaining. Pertussis صح؟ هلا pertussis whooping cough is it infectious? The whooping cough. It's infectious صح؟ So if I have a child who has whooping cough, which now I have to go through all of the household members and make sure they get vaccinated against it صح ولا لا؟ That was the whole point of the question. إنه the second part was different. إنه some of them say only the sister, some of them say only the father, some of them say كل الفامily. Okay, makes sense. خلاص, does this make sense? ما هو yeah. Yes. Yes. No, they're both mentioned in your slides. Huh? That's it. بالضبط. Yes. Okay. ما هو this is micro من الآخر. It wasn't a pharma question, you know? Okay. Does this part make sense? Okay. Okay. What do we use to treat whooping cough? ماشي. Right? We see إنه خلاص we can get rid of D صح and we can get rid of F صح because we want to treat the patient themselves صح دخلني في الأب right now I need to focus on my patient hello so now I have A B و C no A B C و E صح now I look at the second part if one إذا أنت عندك whooping cough صح وعايش معك عيلتك كلها do I not have to treat the whole family مرة واحدة معاها صح ولا لا صح أنت معايا ولا is it not infectious
بعطي العيله كلها
بالضبط. So we give you the azithromycin but the whole family I'm gonna give them vaccination على طول عشان because they still did not get infected yet so I want to prevent them from getting infected. That was the whole point. Make sense? خلاص easy this question? Okay. Wait, I think this we already did this, huh? Yeah, we did this, huh? Yeah, we did this. So sorry. Okay, يلا. This one. لا hey just a picture ما هو I gave you this picture as a hint of what the question is going to be about يعني من الآخر E E what's the final answer
هو ما كاتبين في السؤال تحديدا الان.
أنا بدي أطلع لكم the exact because this is Ambo's question.
الإجابة دي
Ambo's
دي عشان
question.
ناخذ إيش؟
What I have it. What's your final answer? D? Okay. خلاص؟ C. This is a bit more advanced basically. But basically here the patient has a clean wound. ماشي? This is I wanted to test إنه فاهمين ولا حافظين basically, right? Okay. Here in this case we don't know if they're immunized أصلا. Okay. So this plays a factor role. إنه if you don't, the question said unknown immunization. So in this case we start with the vaccination على طول. ما هو first we start with this بعدين we give them the immunoglobulin. They said the most appropriate next step على طول. What's the first thing you do? Huh? Yes. This is Ambo's question. Based on the symptoms, they were like خلاص على طول giving them a vaccination. And then this is followed by the tetanus immunoglobulin after. Yeah. Well, based on what it says here in the answer, إنه indirectly yes. Indirectly. شفت الأمبوس questions؟ اللي بدك إياها؟ There you go. يلا next question. اللي ورا. إيه؟ You sure؟ بدك تغير؟
لا تغير.
Yes. It's B, not A. GABA is affected in tetanus. مش. Do you know why ولا؟ بالضبط. It blocks the GABA release. بالضبط. It doesn't inhibit the acetylcholine release. ما هو in tetanus what happens?
Acetylcholine is released more.
بالضبط. Tetanus what's one main characteristic? Rigidity. إنه their muscles are in constant contraction. صح? If we don't have acetylcholine, will we have that? Will we have contraction? Oh yeah. Well, what is acetylcholine? It's a neurotransmitter that connects information. صح ولا لا؟ بتوصل المعلومة من this place to this place. If I don't have acetylcholine, am I gonna have rigidity? لا. So that's why it's not A. It's B. Okay? Makes sense? We move on? Okay. Hiya. This is what I was talking about. This is the picture that was in your slides. Makes sense? Also, please memorize the names, tetanospasmin and those names because they could ask about it. Yes. Memorize them and they're the key factors playing in this case. What? Yeah, endotoxin.
What do you do?
It does this. What are the toxins gonna do? You don't need to know about the other one as far as I know. على الأقل إحنا we weren't told about it. Were you guys discussed about the other one? Yeah? Yes. Yeah, it's just basically the best friend that's following around. لا يعني. Let's just know the main one and then know the main mechanism that's happening. Okay? Yeah, next question. Plastic? Okay. Okay, makes sense? It's stated in the slides. Why is it not flaccid? Flaccid paralysis means this paralysis, مش this paralysis. Okay, it's the opposite of the tetanus paralysis. Okay? Know these, the sequence. مش عارفة ليش it's written fill in the blank. know the sequence of events. تروح من فوق, from up to down. ما في fill in the blanks.
Look, Joe.
Go from up to down. Know the sequence of events because he could ask you which one comes first. Okay? عكستوها السيكونس أنا عكستهم بس يلا now fill in the blanks. This is for the neonate part. يلا Julie go ahead. 2 okay بعدين what's the second one? What's booster dose? Last one? Tdap ولا the other one? Immunoglobulin. صح? Yeah, you don't give Tdap here, you give the immunoglobulin. Okay? They could ask, okay, if we have a pregnant woman, what am I going to give? If I have an unimmunized pregnant woman, what do I do? These are important things you should know because they could كمان بيلعب بالكلام here. Okay? Okay, what's this? What's the microorganism? DPT lecture. خلينا نضل DPT. نروح staphylococcus aureus لا. DPT lecture. Which one? And we spoke about 3. Which one of the 3 is this? I'm trying. مش clear.
هاي شكلها بسلايد.
كيف bacilli? Okay. Who says diphtheria? Okay. Pertussis. Okay. 1 person. وبعدين 2 3 4. Tetani. Who says tetani? لا يا جماعة. It's pertussis. It's pertussis. الحين you see the difference when I go through them. طب what is the type? Pertussis. إنه gram negative, gram positive, gram negative. Okay. How does it look like? Coccobacilli because we see makes sense why they're coccobacilli صح ولا لا? Sorry. بعدين is it anaerobic or aerobic? I think. The next one you'll see a gram positive one. كمل في السلايدات. Yeah, you agree? الحين we go to the next one and you see the difference between a gram positive or gram negative. Okay? هاي شو؟ diphtheria. Gram positive, gram negative. Positive. شفتوا كيف مبينة purple? It's not like the other one. The other one looks pink. Okay? مش مقتنع بس memorize زي ما هم. كمان the other one it looks like coccobacilli. احنا we know that the coccobacilli is the pertussis one. صح؟ خلاص just know find something عشان تفهم حالك you know? Okay? طب what is the stain used for this? Albert stain. Okay. What the type? حكينا it's gram positive. طب aerobic, non-aerobic. Aerobic. حلو. Okay. Last one. Okay. Positive, negative? Positive. Okay. Anaerobic. وكمان what's special about tetani? Who said it? مين حكى؟ Yes, spore forming. Okay. خلاص. DPT okay? Okay for now? If you have more questions, ask me بعدين. Okay?
Okay. Now we're gonna start by the first lecture of Dr. Hiba Microbiology. Now we'll talk about staphylococci. First, before we talk about anything, I wanna best only detect something from this question. So try to solve it. We'll get into the explanation, but try to solve it. Okay, so you are between B and C. There's something in the question that
سي لازم سي ما في كلمة فص في بايوجين ما قرأش أوربس
okay. So what is the answer? Okay. Anyone explain why? Anyone can explain why? Something else mentioned here. What is suffering from? Skin soft tissue infection, which ليش هذا مش شغال؟ Okay. They are caused by Staph aureus, strep, pathogens. شو الفرق بين الاثنين؟ نعم؟ Does not cause abscess. Does not.
كلامك صح كلامك صح
Does not cause abscess. Okay. Now for Staph aureus, I know for my side يعني when I was year one, it was a bad introduction يعني for me لأنه ما شاء الله عليها تعمل 7000 infection overlapping with 7000 بكتيريا ثانية, so it was a little bit confusing, but we'll try to simplify it. For Staph aureus هي من نوع البكتيريا does not cause harm, does not cause benefit, stay in your body for doing nothing. Now, where is the most area that is located? Nose? Skin. Where is the skin? مكتوبين. Armpit, groin, and skin folds. It's also in the hand, but these three will be حتى هاي will be very important to distinguish when we talk about the clinical question. We'll get to know what I mean. Now, for Staph aureus infection, we did say that it have multiple diseases. It can cause cutaneous infection, toxic mediated, and invasive. Invasive mean the bacteria itself it's causing the disease. Now for the cutaneous infection, the first three pneumococcitis, furuncle, carbuncle, all of that are hair follicle infection. أول وحدة بتكون شوي superficial and does not cause any general symptom. هاي بتنزل شوي للروot of the hair follicle, also no symptom. آخر وحدة multiple hair follicles كلهم مع بعض, and now you are having abscess and general symptom. Now for impetigo and cellulitis, both of them are not specific for Staph aureus. Also pathogens called them. كيف نعرف؟ one is staph, one is strep. شو الفرق بيناتهم؟ شو التست؟ Yes. Okay, that's for impetigo for example. شو الكاركترستيك تبع الامباتيجو؟ when it ruptured احكيها هلا كتبتها with كمل الجملة للأخير. أيوة erythematous base, كملها للأخير. Now for cellulitis حكينا you can do catalase positive, catalase negative. هلا أنا حكيت لكم بس في clinical difference بيناتهم في الquestion. Cellulitis by strep does not form abscess. تمام. Abscess happened mainly with Staph aureus. honey crust when it ruptured انت وقت تحكها when it ruptured it will form honey crusted area with erythematous base. البيس هيك بتلاقيها حمراء. Now for the toxic mediated infection we start by the SSS اللي هي very specific to Staph aureus عكس الامباتيجو والcellulitis. What is cause it? شو اللي بالستاف aureus? What is the clinical sign for it? when it أيوة من هون أخذ التوكسين أصلا اسمه. First this disease start حتى أنا put it for you sketchy start at the red color around the mouth, then it start to go other area. فور ستاف اوريوس قبل ما نكمل بقيه التوكسين، شو المين فايلنس فاكتور تبعها؟ بروتين A. What it does؟
انتي بودي
صح، كمل. صح. Do you remember that؟ yes. الانتي بودي هم اللي كانوا بيساهموا بالاوبسونايزيشن. also they activate the complement system which do opsonization as well. So they attack the antibody, prevent the antibody from working. هذا protein A and that the main valence factor تبعها. في عندنا ال PVL which is I forget to mention it بس خلينا نرجع شوي. Now for PVL what it does it kill macrophages. هاي بتتلاقى بس مع ال community acquired community acquired staph aureus. شو علاقة ال PVL بالنيمونيا؟ والنيمونيا هون نيكروتايزنج نيمونيا. شو علاقتهم؟ لأنه it kill the macrophages. شو علاقة الماكروفاجز إنه عم تعملي نيكروتايزنج نيمونيا؟ Didn't get the question? PVL what it does? One of the violence factor for community acquired staph aureus. شو علاقة ال PVL هو اللي بيعمل في حالة إنه ستاف أوريس عملت نيمونيا، هو اللي بيعملها نيكروتايزنج نيمونيا. شو علاقة النيكروتايزنج نيمونيا بالماكروفاجز؟ to make it understand إنه بس ما نقعد عم نحفظ. when you get inhaled staph aureus you انت have already stayed macrophages there. macrophages بالعادة بيكونوا مونوسايت بعدين بيطلعوا للسايت of the infection whatever. بس انت عندك باللنج macrophages they stay in the alveoli of the lung. So when you inhale it, this toxin attack it. It die by necrosis or apoptosis? Necrosis. What necrosis do? What inflammation do? More macrophages. More macrophages come, more necrosis. It's a loop then. الكوميونتي اكوارد نيمونيا تبع الستاف اوريس اكثر شيء سبيشال about it form abscess or necrosis. وين السيلولايتس؟ اوكي. For cellulitis, what's the meaning of cellulitis? cellulitis هدول كلهم superficial حتى الامباتيجو بالابيديرمس بس. هاي first it affect the deep skin dermis and the fat layer below it وسريعه حتى الجلد بيكون احمر بسرعه يعني هيك كله هاي بس تشوف واحد جلده احمر هيك كله فجاه it's a sign of cellulitis وسريعه بدغري رابط. both aureus and staph peregrines cause it. شو الفرق بين الاثنين؟ في انك تعمل كاتاليز بوزيتيف كاتاليز نيجاتيف تيست وفورمينج اوف بس. حتلاقي عنده للي عنده ستاف اوريوس في هيك مثل بلجنج هذا تحته في بس. get it؟ yes. في skin soft tissue infection. okay we did mention this. المهم for SSS again it affect neonate not children يعني لازم يكون بيبي صغير بالعمر. and actually شو الصين اللي هو حكى عنها انه الجلد بيتقشر when you do pressure on it what is called you could ask they could ask you about that. Okay, now for staphylococcal toxic shock syndrome which is caused by TSST which is another toxin by staph aureus. This toxic shock syndrome in general هي اصلا يعني main violence factor تبعها للستريب بس الدكتور mention it here because it want to get you a clinical scenario. شو الفرق او يعني شو بتتوقع انتم؟ I think they are mentioned in your note as I read them يعني. هون شو اللي حيميزها الكلينيكال سيناريو اللي حيميزها عن الستريب انفكشن اللي هي التوكسيك شوك سيندروم؟ read it. Do you know why? Okay, I will get to what is super antigen. شو علاقتها بالمنستريال women? They do not use tampons correctly. It was in your note, guys. Yeah. septicemia شو septicemia؟ staph aureus love blood. So when يعني girl does not take care of herself and do not whatever, what will happen that the staph aureus will colonize that area. After a while it will start to secrete التوكسيك. تمام؟ ليش؟ لانه الستاف اوريس هلا احنا نعرف انه هي حتى اصلا cause of septicemia, so it loves the blood. You got what I mean يعني صح؟ got it؟ هذا الكلينيكال سينونيم اللي حيجي عليها اس تي اس اس لانه كثير هم بيشبهوا بعض بين ستاف اوريوس وستريب. both of them cause toxic shock syndrome. تمام؟ اوكي اوكي say the answer. اوكي لو ملاحظين ما في خيارات. ليش؟ you need to understand the question. ليش؟ هذا الكويشن did مهم. you got what I mean. okay when you read the question try to understand it correctly لانه هي كان هذا كله ممكن يكون ما له طعمه. he is giving hint to staph aureus بس وبده المين فايلنس فاكتور تبعه اللي هو بروتين A. بدك تفهم هو شو what he meant by the question لانه it was okay you got what I mean. I can't. تمام. for food poisoning هي تقريبا ما اتوقع ان حنجيب لكم سؤال عن food poisoning لانه هي البكتيريا الوحيده اللي اخذتوها food poisoning لهلا، بس لسه عندكم اتوقع 2-3 غيرها. سو بس for your information food poisoning شو السبيشال فيه عند الستاف اوريوس؟ very fast يعني تقريبا 3-4 ساعات associated with vomiting more than diarrhea والdiarrhea هون is not bloody. you've got to know that يعني later. اوكي ليش هون سريعه؟ it's very fast unlike other.
toxic is there already.
okay that's correct. Now, for the invasive staphylococcal disease, I know it is a little bit confusing because a lot of these بيجوا كمان مع بكتيريا تانية. بس for PACademia which is bacteria in the blood, staph aureus و strep pneumonia هم أكثر جرام بوزيتيف، أكثر 2 بكتيريا بيعملوا بالجرام بوزيتيف بكتيريا بيعملوا لنا بكتيريميا. اندوكاردايتس لان هلا اتوقع انتم اخذتوا 4 بكتيريا that can cause endocarditis. I know it is confusing how to know the difference between them. اول شيء شو اللي بيعمل endocarditis؟ staph aureus. اوكي viridans epidermitis وانتيروكوكاي. what is the difference between all of these؟ اول شيء ممكن يحكوا لكم كاتاليز بوزيتيف كاتاليز نيجاتيف بيتا هيموليتيك ولا هي حتساعدكم، بس كلينيكالي شو الفرق؟ for endocarditis that caused by staph aureus حتفهم من السؤال انه المريض شوي راح يموت. it's very severe symptom. the patient can die with 2 to 3 days. هي بيقولوا له اصلا الاكيوت endocarditis بتطلع symptoms heart failure يعني it's very severe. اوكي تمام. for epidermitis do love everything that is prosthetic. Why? Because they have what? They do biofilm. Okay which هو الكاركترستيك هاي تبعها مو البايوفيلم مو بس هو للابيديرماتس، بس الابيديرماتس اكثر وحده ديفلوبت لانه هلا I mentioned something about staph aureus in general. Now for strep viridans هي اللي بتعمل السب اكيوت يعني حيجيك المرض ممكن يجيك على الامرجنسي بس he's stable, he can walk, he can talk to you, he's stable. هيك حتفهم من الكويشن. so it is strep viridans. also strep viridans do affect prosthetic valve. how to distinguish them between staph epidermitis و strep viridans? from the scenario dental procedure لانه strep viridans are in the mouth mainly. he cut in the gingiva عمل dental procedure trauma in the mouth whatever يعني that can disturb the mucosa here it will cause by staph viridans. as well as staph epidermidis. mostly it is hospitalized. صح بتاخذها انت من برا. ليش؟ حكينا because of the biofilm ability. most of time هاي I will mention it لما بده يجيب لك epidermidis they will mention انه المريض in ICU كذا الى اخره. why يعني mention ICU؟ لانه المريض بال ICU بيكون حاطين فيه 7000 شغله. كاثيتر على IV access على يعني most of time he get epidermidis there. endocarditis it is part of which flora? which system flora? enterococci. if someone do have injury there, colon cancer, multiple thing, he do surgery there, whatever, in the UTI, it will high sign of endocarditis because of enterococci. staph aureus غير انه بتعمل acute endocarditis, they will mention as a hint if they mention it IV drug abuser. when IV drug abusers mainly take the drug, elbow or the knee, which are skin folded. That's why I mentioned it back then. Okay. For osteomyelitis, it is the most common cause in children. When it's happened in adult, معناها المعلومة غلط, بس it happened in the spine. That's what your slide mentioned. For pneumonia, the distinguishes between staph and strep pneumonia. النيمونيا هون بنحكي لها forget about يعني secondary, بس it happened after viral infection. صعب تجي النيمونيا في الستاف اوريوس لحالها as a community بدون viral infection. هلا بنفهم وين بتجي لحالها, بنقول هاي ventilator pneumonia. اوكي. patient got whatever kids got a viral infection بعدين he developed pneumonia, حتختار strep pneumonia ولا staph aureus؟ ventilator pneumonia, as I mentioned, staph aureus do have the biofilm ability, بس هي مو المين فايلنس فاكتور تبع, حتى it was not mentioned لانه it have multiple thing, يعني عندها توكسيك, عندها whatever, ما حتعتمد كثير على البايوفيلم. بس وين البايوفيلم تبعها does give its advantage in with ventilator. patient on ventilator can't cough. تمام. cough is a protective mechanism to kick out dust, bacteria, whatever. staph aureus لانها do have this biofilm ability, do stuck there. when you are not able to cough or you have injury to the respiratory function, it colonize and do, هون هي ممكن تعمل primary pneumonia. تمام. اوكي. staph epidermidis. تمام. طيب انا بس see if you can answer this question. اذا لا والدكتوره ما نبهت عليه so we can skip it. اذا في شيء so I will make more details. it is B. ليش؟ هذا بروستاتيك وفي ستريب فيريدينز وستاف اوريس. did the doctor mention anything about that؟ وما في هون اي بس هون هاي المعلومه الوحيده. because I لا epidermitis ايوه epidermitis when it's happened I don't know if يعني you need to know this information, بس اذا اجى هيك سؤال احتياطا because I see it لما من بدايه العمليه لبعد شهرين it is epidermitis, بعد الشهرين it is strep viridins. تمام. اوكي. if نعم بس بعد الشهرين. I know I mean for this question مو after 8 months, after 2 months. for 2 months epidermitis. اذا اجى بس هيك سؤال بس بالduration epidermitis. هي it is bring to the هي صح, هي غلط, بس it is part of the ما حط step viridin so بتحط epidermitis بس you know it. هي معاه حق، اللي بدل ما تسوون غلط لازم يحطوا ستريب فاريبل. لا. No, for MRSA. What's the meaning of MRSA? Resistant staph aureus to penicillin. مو penicillin بس. All beta-lactam antibiotic. ما حينفع معها غير مين؟ I don't know if you study pharma. اوكي with ليش؟ لانه هذا صح سيل وول انهبيتور بس ما بيعتمد على beta-lactam. تمام. For MRSA هلا in general for we talk about community acquired hospital acquired in general يعني بغض النظر عن الميرسا الكوميونتي اكواد عنده هاي فايلنس سترونج ديزيز and affect healthy people ليك هي سترونج اوكي while the community acquired hospital acquired you must be immunocompromised to be affected بس شو الفرق because it is in the hospital وعم تتعرض كثير للانتيبيوتيك it develop high resistance to the antibiotic يعني اوكي it can't affect me it can affect you it can't because we are healthy people once you are immunocompromised it takes the chance and then it causes severe symptom تمام اوكي هلا for MRSA in particular community acquired MRSA حكينا it is resistance to what only beta-lactam from its name most of time it is associated with skin soft I'm اقول لك I think in your slide it was 75% skin soft tissue infection بيجيك السيناريو واحد كان shivering his armpit he have cut their wound whatever then he developed infection it is community acquired or hospital acquired community most of time it something else ايوه الكوميونتي اكوايرد خصوصا انه هايلي كونتيجيوس لانه most of it skin soft tissue infection وبكون بيطلع كثير احيانا بص من المريض سو في الكلوز كوميونيتيز زي البريزن ميليتري اثليت اللي هم بيكونوا في ويندومز all of يعني هيك ممكن تجيك في السيناريو because the doctor mentioned it in the slide while في hospital MRSA what okay for hospital MRSA it is resistance to beta-lactam and other antibiotic عاد هو وحظه we don't know what is the antibiotic لانه it is hospital acquired might be resistance to الانتيبيوتيك اللي كان في الهوسبيتال هذاك اليوم whatever تمام ف we can't say انه it is for the هون حكينا شغله ال PVL which is caused necrotizing pneumonia اجاك واحد مع ventilator pneumonia تمام اللي حكينا عنها قبل he will develop necrotizing pneumonia ولا لا despite secondary هاي for year 2 information I'm talking about necrotizing pneumonia if he got it from the ventilator it will develop necrosis or lung abscess why ventilator are in the hospital
hospital acquired ما عنده PVL
ايوه
فما حيعمل نيكروتازيك نيمونيا حيعمل فنتليتر نيمونيا
اوكي نعم على السريع ستاف epidermitis as we say most thing تبعه اللي هو البايوفيلم so it is love to attach to prosthetic thing ومينلي I will say حتلاقي في السؤال حاطينه بالاي سي يو حاطين له كاثيتر حاطين له وات ايفر فكل هدول كانت بي بكتيريميا بعد الكونتامينيتد اي في اكسس could be endocarditis could be urinary tract infection if they put them the catheter there it could be هي most of them it is hospital acquired and opportunistic it can't affect healthy people so saprophyticus most easiest one it is with sexual active people and it happened with after the first 6 years with almost 24 hours بس هذا الشيء مميز فيها and yeah
Okay, so ما حنطول عليكم. This is inshallah going to be the last difficult lecture that you guys have in your mid-unit, which is streptococci. So you guys see this algorithm? You have something like this بداية your slides, but your doctor made it. This one I got it from the first aid book, and it's pretty much similar, and it contains again how do you differentiate between strep and staph. by the catalase test. And how do you differentiate between different types of streptococcus? By the hemolysis. You have alpha hemolysis, which is partial. You have beta hemolysis, complete. And the gamma hemolysis, no hemolysis at all. And then you also need to know these optician sensitive and bacitracin sensitivity very, very, very well, because this is going to be one of the keywords that you will use in your questions to differentiate between the different bacteria. So as I said, make sure that you know this properly. Well, I recommend you guys, like when you get, what do they call it? A scratch paper, try to draw it briefly. So when you're answering the microbiology questions, خلاص, يعني you eliminate. مثلا you see catalase positive, you eliminate anything that's catalase negative. Okay? So familiarize yourself with this very, very well. Okay, first question. 60-year-old man presents to the ER with high fever, productive cough, chest pain, and important thing here is you have gram positive diplococci, and it's optician sensitive. So which one is this? Yes, please. Strep pneumonia, exactly, bravo. Okay, let's talk a little bit about Streptococcus pneumonia. So important that strep pneumonia is one of these drugs, one of these bacteria that come in pairs. So how do you remember that? Can you guys focus, please? So how do you remember that it comes in pairs? Pneumonia affects the lungs. How do the lungs come? In pairs. If I remember, diplococci. And here I'm going to use the letter P a lot. So P for polysaccharide capsule. Keep this in mind. It's one of the important capsulated bacteria in microbiology, and this is a virulence factor. It's what causes the disease to be, let's say, strong and bad. And then you have the alpha hemolytic. Alpha, there's a P here as well, so remember alpha hemolysis or partial hemolysis. There are two main diseases that are known for strep pneumonia, and I want you guys to know them very well. من اسمها strep pneumonia, so community acquired pneumonia, as well as meningitis. هلا meningitis in neonates or adults? What do you guys think? Who says neonates? Exactly, and I'll get to that in a bit. So differentiate between meningitis in adults and meningitis in neonates. Here, it's adults meningitis. A quick mnemonic to remember this is MOPS. M for meningitis, O for otitis media. Otitis media is basically inflammation of the middle part of the ear. And you'll see this a lot for understand what's otitis media. P, pneumonia, S, sinusitis, okay? How does it get transmitted? We know pneumonia, it's a respiratory infection. PACademia, it's going to be transmitted by droplet transmission. And again, the P is here for optician sensitive. Verdans, on the other hand, is what? Optician resistant. So differentiate between these. You need to know them very, very well. Okay? And the two vaccines are available. For infants, we give the pneumococcal conjugate vaccine, PCV13. I think you guys saw this in immunology lecture for vaccines. Anyways, and you have the pneumococcal polysaccharide vaccine, PPSV23, for adult patients. So this is the most important things you need to know in one slide only for pneumonia. Okay? Don't make it too complicated for yourselves. So, moving on. Oops. Yeah, this question. Who wants to read? Go, Jana. Yes, optician resistant, correct. Which one is it? Let's eliminate it one by one. Let's, we see catalase negative, so what do we eliminate? The staphylococcus, صح? Staph راحت. We have strep pyogenes, strep pneumonia, and verdant streptococcus. Another hint that was given was alpha hemolytic. Okay, keep it in mind. And optician resistant. And I told you pneumonia is optician sensitive. Now I'll give you a mnemonic as to why verdant is optician resistant. Another important keyword here is aortic valve disease. As Mohammed Saleh explained, verdant is an important causative factor for endocarditis. But usually they will not just say endocarditis, what's the agent? They will tell you more information. They will give you catalase, shoe, what's the hemolysis, so you'll be able to narrow it down. All right, so quick information about viridans. There are many different organisms here. Usually alpha hemolytic, it might also not cause hemolysis, and it's normal flora of the upper respiratory tract. The mnemonic here that I put is that the viridans, because it lives in the upper respiratory tract or in the mouth, it's above the chin, it's not afraid of the chin, so optichin resistant. I don't know if this is going to help you guys, I put it here both ways, okay? Heart valves, the letter V for viridans, so you can remember it well. The diseases here, there are several diseases, as you guys can see. Abscess formation in deep tissues by this one. But in my opinion, the most important ones you need to focus on are dental caries by S mutants due to what's the virulence factor here? Biofilm. This is a very high yield thing. You guys need to keep this in mind. And the others, familiarize yourself with them. But personally, I feel like the dental caries one is a very high yield. طيب, another question. Yellow, one of the girls, try. So basically, let's see the first one. Strep pneumonia is alpha hemolytic and can be serotyped on the basis of a polysaccharide capsule. Is it correct? Yes, everyone agrees it's correct. Right, second one. Interior cocci were previously grouped T streptococci. It can be classified by their ability to grow in 6.5 NaCl. Correct ولا لا? Correct? Correct. Okay. Strep pyogenes, alpha hemolytic, bacitracin sensitive. This one. What's the wrong in this option? Exactly. It's beta hemolytic. طيب. Actually, yes. Okay. طيب. Another one. Yes, sure. Okay, serotype, it's basically, it means إنه يعني you analyze what's the microorganism in these species. How can they know إنه this is, for example, strep pneumonia due to the presence of the polysaccharide? هتبين clearly when you're looking at it under the microscope. Did you understand that point? للأسف I'm not a microbiologist. للأسف I can't give you an answer. لا لا don't overcomplicate it. Serotyped in general means إنه classified essentially, okay? طيب. So back to this one. So we have a 36-year-old male. He has severe leg pain with laceration. Keyword here is that there's necrotic tissue, and the gram stain revealed gram-positive cocci. Culture showed complete hemolysis. So what type of hemolysis is this? Alpha, beta, or gamma? Beta hemolysis. And what else is here? Catalase negative, coagulase negative. خلاص أعطيتكم الجواب. What is this? Again, this is pyogenes, exactly. Now, Streptococcus pyogenes is known for being a cause or being a flesh-eating bacteria. If you ever see any sort of infection where there's necrotizing or there's, يعني بالآخر, it's flesh-eating. You guys know what flesh-eating means, right? Necrotizing fasciitis, exactly. Now I'll talk more in depth about it. So pyogenes, it's group A streptococci. How do you remember it? Bake a pie. تمام? Beta hemolysis, baking pie, B, beta hemolysis. Again, another B, bacitracin sensitive. The diseases that are caused by strep pyogenes, I've divided them, or they're divided like this in your slides. We have the superficial/deep infections like PH, pharyngitis. This is a very, very, very important one for strep pyogenes. Invasive infections like cellulitis, bacteremia, pneumonia, necrotizing fasciitis, as you mentioned. Focus on this one because you'll probably get a question where they give you a scenario about necrotizing fasciitis for pyogenes. And for immunological illnesses, you have glomerulonephritis, acute post-streptococcal glomerulonephritis. So focus on the pH again, it's here. Rheumatic fever, تقريبا يعني there's a pH here كمان. Rheumatic fever is also a very high yield point to focus on for streptococcus pyogenes. And then you have toxin-mediated diseases like streptococcal toxic shock syndrome. You guys saw staphylococcal toxic shock syndrome, but this is different. And again, necrotizing fasciitis. And because it's a respiratory disease, it's spread by respiratory droplets. Do you guys want to ask anything about pyogenes? Is it okay? Clear for everyone? Tamam. Okay. Yellow, this one. So we have a woman. She came with fever, chills, etc., and she had a normal vaginal delivery. So this is a keyword here. On examination, tender uterus, elevated white blood cell count. We don't really care about this. Blood cultures were taken, and she does have a bacterial infection. So based on the scenario that I gave you, I know she's a woman. She just gave birth. Yes, or no, you already answered. What do you think it is? First, what's this? Agalactia. Okay, and the answer? A. Does anyone agree and not say? It's a positive CAMP test, not a negative CAMP test. Causes meningitis in adults, neonates. And then we have partial hemolysis in sheep blood agar, beta hemolytic complete hemolysis. Is it resistant to bazostracin?
Yes.
It is resistant to bazostracin, exactly. Resistant, as you can see. Now, some important things about agalacticae. Group B streptococci, B for what? For babies. So it's beta hemolytic. It causes neonatal diseases. So meningitis, neonatal meningitis. It can also cause pneumonia in the neonates and bacteremia. And because, come on, it's a part of the normal flora for women, it can cause infections in pregnant women specifically, like endometriosis, endometritis, wound infections, UTIs, and in other adult patients, this is not very common, but sometimes in very rare cases, it can cause bacteremia, pneumonia, bone and joint infections, SSTIs. So I put for you this picture from Sketchy. I think I'll explain to it. I'll go through it right now. So this light bulb B for beta hemolytic, this is the sign that they use for the CAMP test, and they also included this here, bacitracin resistance, and it can cause pneumonia in adults. Exactly. Does anyone know what does this? Septicemia? Well, bone and joints problems. No. Because he's on his basically, no, they have different symbolisms here. And as for pregnant women, because it's considered as an important thing, and the CDC recommends, and pregnant ladies between the weeks of 35 to 37 weeks, they need to get a swab to check if they are at risk of giving their babies the group B streptococci. Exactly. And if they are, they have to give the woman penicillin as a prophylaxis. Tamam? So keep this in mind. This is very, very important. Okay? Does anyone want to ask anything for agalactia? It's very easy. Yes, go ahead. Yes. And adults as well. But I think if you were to ask me, yeah, for adults, they have to be immunocompromised. But for kids, it's common. Okay? Tamam? All good? Okay, next. So we have recent hospitalization, surgical procedure, and they had symptoms, fever, malaise, dysuria. And they saw that her symptoms were part of the organism was a part of the normal flora in the large intestines, and it's found in many stool samples. Which one is this? Yes, please. The gram-positive coccus. Okay, what's the organism? Exactly, correct. So the high yield information for enterococci is that it grows in salt and 40% bile. This is something really important that you need to keep in mind for it. And it's known for resistance. I don't know if you guys went through it in pharma. Did you learn about vancomycin resistant enterococci? So this is also something else you need to keep in mind for this. So really quickly, as I said, grows in 6.5 NaCl. You can see in faecalis there's Cl. So in NaCl command, there's Cl, so keep that in mind. 40% bile, no hemolysis, gamma hemolytic. Entero for intestine, faecalis and feces. So you know that it colonizes the intestine normally, and it can be found in the feces. And what else is very important here to mention? The difference between faecalis وفيسيوم إنه they're both found in the same areas, but if you were to take a sample, which one are you gonna most likely find? Faecalis ولا فيسيوم? Faecalis, exactly. Faecium is present in very, very small amounts. If you find these in different parts of the body, what does that mean? Like, for example, they took a sample I don't know, من the lungs, and they found these. There's a problem, exactly. Because let's say, for example, the patient was hospitalized وصار في some sort of nosocomial infection, you will probably find it in another area. And what diseases do they usually cause? Okay, UTIs. Yes, it is they're one of the ones that cause endocarditis, but it's not very common. Wound infections, mostly intra-abdominal, they're caused by several types of bacteria, not just enterococci. And bacterium is the last one. And if they ask you what type or what's the test that you use to identify enterococci? Bile aspirine agar, exactly, excellent. Okay, extended matching question. I don't know if you guys will have this, بس يلا, we can practice for your final both ways. يلا, first one, ما جارش, because you said we will not have it.
meningitis and units galactic.
Okay, next one. Resistant to salt. Okay, flesh-eating diseases. Otitis media. No other answers? Okay. Bacterial pneumonia in adults. Strep pneumonia again. Who's bacitracin sensitive? No other answers? Okay, pyrogen is correct. Capsulated. Virulence factor producing biofilm. من السترب. في واحدة I mentioned it. Viridans. Which one was it? Mutans. Mutanzomyces. Sorry, yes. Pyrogens. What's wrong? I explained it. Let me go back to the slide again. It's flesh-eating, يعني muscles with skin. It causes infection where you'll see the muscles with the skin is dying quickly, was getting eaten up by the bacteria. I don't know if you saw the picture in your slides. That picture makes the most sense. Do you have the picture? Anyone? Can you show it to him so he understands what exactly it means and it's flesh-eating? Picture مو كتير حلو, just a warning بس يعني. Necrotizing fasciitis, exactly. Okay, does anyone have any questions? All good? Yalla, best of luck, guys. Now we're going over the mechanisms of microbial disease, okay? Did you guys go over this lecture or no? Yes? Yes. You went over it? لا. زمان. Okay. خلاص. يلا. Matching time. Let's go. Primary pathogens. Which one would it be? Last one? صح. Okay. Next one, opportunistic pathogens, which we already indirectly took in the microbial flora. B, okay. Pathogenicity. A, pathogenesis. صح. And pathology? Straightforward, صح? The whole lecture is straightforward. Okay, pathogenicity or virulence, you need to know the difference between them because they could put both options in the answer and you need to know which one is which, okay? Pathogenicity, when I say something is pathogenic, I mean it has the ability as a microorganism to cause a disease, okay? But when I say virulence, I'm talking about how severe or the degree of pathogenicity. Does that make sense? Think about it when you hear virulence, V, severity. Like I capitalized the letter V in here, okay? Know the difference between them because they're usually, like most 90%, you'll have a micro question, you'll have pathogenicity and virulence in the same
question and you need to know which one is which. Okay? خلاص, do you understand the difference between them? Yeah? Okay. LD50 and ID50. Does anyone not know what they mean? Or do you want me to go over them? Okay. LD50, 50% lethal dose. Okay? From its name, lethal dose, I'm talking about killing. Okay? Straightforward. Always link the words to the name. Okay? So it's basically the number of organisms required to kill 50% of the infected host. Yes. Yes, literally. Micro and pharma connected always. There's always a connection between them. So it's the same concept as the one in pharma. When we say infectious dose, infectious, I'm not talking about killing here. I'm talking, I just caused the infection. Okay? So lethal dose, I'm talking about killing. Infectious dose, I'm talking about actually causing the infection. Okay? Makes sense? What's the difference between them? خلاص, I move on. Matching question. Endemic is what? A, okay. Epidemic. Last one, pandemic. E. Straightforward. Always try to find a specific word. Epidemic, as soon as you see the word sudden or very quick, just know it's going to be epidemic. Okay? Who can give me an example of an epidemic? There you go. Okay? Influenza, epidemic. Seasonal epidemic actually, because every season we have influenza. صح ولا لا؟ No, لا. If it's a specific area, particular area, epidemic. It's just that area basically. But if it's different parts of the world, but it's not a pandemic, it's not global. But في specific parts, okay, what suddenly happened, endemic. خلاص, we know the difference between them? No? Okay, خلاص. Okay. Next question. يلا. Incubation period. Straightforward. The questions for this lecture are straightforward على طول. And they're always so easy, so straightforward. So this lecture should be easy marks, in other words. Okay? Next question. B, do you guys agree? B? Yeah, take your time, Andy. B, straightforward, صح? يعني the others don't make sense. I'm talking about declining. Obviously, the A is wrong because it says it's multiplying. If it's multiplying, will my disease decline or incline? Incline. So, يعني, it's a straightforward concept here, right? This is basically, this one, it gives you a visual idea of what's going on during the infection. Okay? Try to know the stages in incubation period, prodromal period, period of illness, all those names, because the answers will be those names, not inshallah that made sense, yeah. Okay. Next question. D, everyone agrees? Makes sense, right? Or if I have a very healthy person, will they get infected with the thing? No. If I have a person who was not what was the word? Who was not exposed to the microorganism, will he be a susceptible host? No. So there are factors that play here so that they can be a susceptible host. Yani they need the perfect host, in other words. Okay, makes sense? Yalla, that's this one. Portal of exit. Again, it's a silly lecture, honestly. Yani. 2. يعني 2 free marks هيك يعني, you know? That's usually how it is. 2 to 1 questions per lecture. Okay, next question. Colonization? Colonization? صح. It's invasion. Why is it not colonization? Who can tell me? Whoever answered colonization, why do you think it was colonization? Command it specified evade immune detection and establish a niche. It said does not have a place to start colonizing. Okay, so keywords. It's a simple concept, but they could play around with the question. يعني هيك كأنه a place, an area. Okay, ما نسمى لها a bait. They couldn't find a place to invade, but they're still they can't find a place to continue colonizing, but they're still trying to invade. Make sense? Why it's not colonization, it's invasion? Sure? We'll move on. Okay. These ones, memorize them. Okay? Memorize the steps, understand each one. Let's go over them quickly. Adhesion. What is adhesion? Exactly. Colonization. What did we say colonization was? Multiplying. Multiplying after invasion. They already invaded. But then we have the colonization. Immune response inhibitors. What does this mean? This is, I just put them like that. Wallahi, let me check really quick for you. I think colonization is after invasion. صح? Am I wrong? Colonization is after invasion. مفروض. زي هيك؟ خلاص. Okay, follow it then. Follow it. Okay? Whatever the lecture says, follow it as it does. Yes. Colonization, colonies. بالضبط. Okay? Just memorize it according to what the lecture says. And I base it on my further knowledge after the years. You know? So if the PowerPoint says this way, memorize it that way. Okay? Immune response inhibitors. What do you mean by that? Is this part of immune response or adaptation? Adaptation. Adaptation is the release of toxins, the capsules. It's trying to adapt to the situation. But when we're talking immune response inhibitors, what do we mean? Basically, they're trying, in other words, they're trying to run away from the police. That's as simple as that. They're hiding from the police. Okay? And to hide from the police, they adapt by releasing the virulence factors. Make sense? Okay? Does that help understand what's this one? What's this one? صح, wait, the last one. Tissue injury. Straightforward, صح? Tissue injury. Do we need to go over it? Yes. Yeah, we know that. I don't think the doctor mentioned it in that details, right? Like I said, lecture very surface level. We don't need to go into details. Like the other lecture I explained DPT, I went into details and all of that. On it's surface level. Do not dive too deep into it. Yani it's straightforward. This one, you know the differences between the exotoxin and endotoxin. Okay? This table, I think it was at the end, towards the end of the lecture. Memorize the differences between them. A question could be from here. And what's the difference? Or what characterizes an exotoxin? Or what characterizes an endotoxin? Okay? You guys have this table at the end, right? You do. خلاص. This table, there is a part about type 1, type 2, type 3 toxins. You guys have it, right? Yes. Those thingies, again, you don't need to know details, just know them surface level. صراحة. This whole lecture, surface level knowledge. Don't stress yourself out over it. Like I said, 3 marks. You know, you saw how easy the questions were. I could not complicate the questions. I tried, but the only hard one was the invasion answer one. No, I played with the words a little bit. That's it. Okay? Any questions on this lecture? No? خلاص? Okay, that's it for my part, basically. Thank you.
Okay. For MMR infection, there are 3 infections caused by 3 viruses. Okay. Now, we'll start by the first one اللي هي روبيولا ب OLA اللي هي بنقلب normal measles اللي هي الحصبة بالعربي. I think إنه هو one of the vaccine that you study in pediatrics. أتوقع سمعتوه قبل يعني when he was in school or whatever. المهم the first line talk about only the microbiology. It was mentioned there, although it was not explained. But for example, that these all bacteria are single-stranded RNA, are negative sense. What do we mean by negative sense? It was not mean negative sense basically بس عشان بس نوضح الكلام إنه شو ال RNA بيعمل single stranded RNA virus بفوت release the RNA and use your machinery cell اللي هي ribosome all of us to make a protein. بيكون جاهز. هذا البوزيتيف سنس. نيجاتيف سنس ريليزد لسه بده 1 ستيب اللي هي بيقولوا لنا ار ان اي بوليميريز انزيم بيأكتيفيتد للام ار ان اي هذا وبعدين it will be active. واحد بس انه when it release is active. واحد it need 1 step to be activated بس. It was Morbella virus family. Morbella virus gene family اللي هي بارو مايكروسيرفايد. تتسمى بال 10 day measles لانه الافرج تبع الانكيبيشن بيريود تبعها 10 days او الريد measles. المهم we'll talk about the stages. First we start by the exposure to the disease. He will have incubation period when he got the infection. He will have it to 1 or 2 weeks. Then he will start to develop flu symptom. We will have pre-modal stage 3 to 7 days. هون المشكلة إنه it is flu-like symptom. ما بيكون باين عليه لسه إنه ما بيكون الراش لسه بينت اللي هي very characteristic to measles. فهم بتكون عنده مثلا fever, flamed eyes, runny nose, all of that. بعدين بعد from 3 to 7 days بتبين الراش. الراش هاي الكاركترستيك تبعه شو؟ انه it is flat, small, وفي الميزلز العادية او الروبيولا بعاد they are isolated. ايوه micropapular and they are isolated. Also الجيرمان measles micropapular بس they are dense قريبين لبعض. تمام؟ المشكلة هون انه حكينا الراش بتبدا قلنا ب 3 to 7 days. قبلها باربع ايام وبعدها باربع ايام بكون هيز فيري كونتيجيوس. هو عم نقول للكل وبكونوا احيانا يعني ممكن بالاربع ايام هاي يكون بالبري مودل ستيج او اللاست داي اوف الانكيبيشن ما بيكون باين عليه اعراض وهي سبريدنج تو ايفري ون. بعدين بتبين الراش. after this happened we enter the final stage. Final stage if it is يعني the patient recover by its own it take 10 days and he will not have any complication. الكومبليكيشن هاي ممكن تبين for example in children or immunocompromised. ممكن يصير عنده pneumonia because it affects the respiratory system. ممكن يصير عنده encephalitis, respiratory dysfunction, all of that. تمام. Usually it does not happen in healthy people يعني. So everything clear about the stages that صح؟ الانفكشس ستيج تبعه وين بتكون؟ 4 ايام قبل 4 ايام بعد. تمام. الانكيبيشن بيريود كم؟ 1 to الافريج 10 days لهيك هي تسمت ب 10 days measles. And yeah I think that's all. Okay. For immunocompromised which as I highlighted لأن الدكتورة أكدت عليها في محاضرتكم إنه خصوصا severely immunocompromised مثل HIV patient الكومبليكيشن هي كلها حتبين بس بدون rash which is very severe. Okay. The only way, can we culture viruses? No. The only way here to detect is by PCR, and I forget to mention it, antibodies for measles. They also can detect if the patient is infected ولا لا. المهم في one important sign هون حكينا هي it is flu symptom, right? في شغله بس ممكن تساعد الدكتور انه يميزها انه هي ميزلز مش فلو. في البري موديل ستيج، نعم اوكي، في البري موديل ستيج راح يصير عنده كوبليك سبوت على الاورال ميوكوزا، it is blue dot sorry white dot. تمام. هلا الكوبليك سبوت in general هي ما سبيسيفيك للميزلز but when it's come with fever it is 100% measles. تمام. which is very discriminating لانه هي مهمه حسنا انت كدكتور لانه بتبين هون قبل ما تبين الراش، فبتساعدك انه انت diagnose it very fast. اوكي. that basically يعني what it talk about. in general all of these virus infection highly contagious مثل الفلو بالاير بالcontaminated contaminated stuff, all of that can spread the infection. Clear? About now the German measles. German measles هي نسخة أخف شوي. ما عندها يعني almost مكتوب 25 to 50% does not develop symptom. يعني ما أنا بالخطورة. هلا we know why they mention it. In general it is حتى less contagious than the previous one. بس شو الاختلافات بيناتهم؟ هي تسمى 3 days measles بس هون هي 3 days للريكفري ما انها للانكيبيشن period. تمام. الراش وقت تبين حكينا شو الفرق بين الراش هنيك والراش هون؟ دنس قراب اكثر لبعض. هنيك they were isolated. هي واحد، هي اثنين. ثلاثة الكونتيجس بيريد. هنيك 4 ايام قبل 4 ايام بعد، هي اسبوع قبل اسبوع بعد. تمام؟ مو less contagious بس عم نحكي على الدايز هي 7 ايام قبل 7 ايام بعد. اوكي. شو الانكيبيشن بيريود قديش بتكون تقريبا؟ ايوه. الخطورة فيها هون مو فيها نفسها، الخطورة فيها إذا pregnant women get it، لأنه one of the congenital symptoms congenital syndrome that happened to baby happened to German measles أو الروبيولا اللي هي بال LLA. أوكي. شو what it can does simply with no يعني we won't يعني complicated بس most 3 abundant congenital defect اللي هي losing vision كارتراكتس اللي هي بالعربي اعتام عدسة العين. you losing vision that simple without no further explanation. Panductus arteriosus cardiac defect. البيبي هون after a while he can develop مو microcephaly cyanosis. اوكي. شو يعني cyanosis؟ yeah yes and microcephaly البرين size get smaller. هاي المين 3 يعني but read the rest. For the mumps is caused by negative sense. البوزيتيف سنس الوحيد اللي هو الجيرمان ميزلز. اوكي. مين الوحيد الجاهز على طول الار ان اي تبعه يعمل انفكشن without any further step؟ جيرمان ميزلز. هذا واحد من الفروقات بين الميكروبيولوجي نفسه. بس الممبس هون حتى تتبع نفس الفاميلي. وين ممبس نفس الفاميلي تبع الميزلز العاديه. اوكي. حتى it is negative sense as well و SSRNA all of that. yes same family. تمام. حكينا عنها highly contagious بس هاي affect what all of them is highly contagious. هاي affect what the salivary gland. بيكون عنده fever. هو ما حيكون عنده symptom لفلو بس حيكون عنده fever muscle pain. يعني هاي general symptom. ما فيك والله تقول he is getting mumps because of muscle pain بس هي general symptom. السيستم السيمتوم الكاركترستيك للممبس هي salivary enlargement تعطيه hamster appearance. تمام. والكلينيكال برزنتيشن تبعها بتبلش من هون near the ear then it get downward and forward. تمام. this is the how the did you get it؟ هون حفظ الانكيبيشن بيريود مهم. حفظ when it's be contagious also is important. هديك الانكيبيشن بيريود اول وحده الروبيولا العاديه الانكيبيشن بيريود تبعها 7 to 2 weeks. when it's contagious 4 days 4 days after. German measles 7 صح. it is less contagious. وشو الراش قلنا تبعها dense قريبين لبعض. for mumps incubation period هي تبعها أطول وحدة 60 to 80 days or 2 to 4 weeks. والincubation period تبعها wait okay الcontagious period تبعها بتكون 6 days before 9 days after. تمام. it's important to memorize this. common complication بعدين ممكن تعملها والدكتورة حكت إنه of ophritis اللي هي one of the ophritis اللي هي for testes like inflammation in the testes. ophritis for the ovaries. The doctor say it will cause infertility. Follow what the doctor say. Pancreatitis is highly associated with it. بس هاي المين complaint تبعها enlargement. هاي الكومبليكيشن بتصير مثل ما واحد immuno compromised او انه ما تعالج الديزيز. كل هاي الشغلات تعمل هاي الكومبليكيشن بس مو هي المين سيمبتوم اللي حتطلع. تمام. make sense. هذا هو الفيروس الوحيد من الثلاثه اللي you can culture it. most of the virus we can't. هذا هو الوحيد بيناتهم اللي can culture it. We also PCR work, antibodies also work, but this special characteristic for this virus. Yeah.